Hi, good morning everyone. My name is Ali Khan. Okay, I am from the BD company. And from the BD we are supplying different kind of medical devices, including the flush syringes, cannulas to your hospital. So today I will not take much time from you. We will just talk about only the BD Nexiva diffusives. Okay, I think most of you are familiar with this IV cannula. Okay, you are using, I think, in the pediatrics 24, right? The yellow color one. Sorry? This one also you are using. Okay, fine. And this is only mainly using for the CT scan, for the MRI procedures, for the power injector. Okay, today I'm going to talk about highlight regarding the complications that still you are facing by using this cannula, and what is the best advantages that are available with this cannula. You should take benefit from them. Okay. First of all, I would like to know that, are you facing any kind of complications by using this cannula or not? Because still, sometimes from the radiology there have been cases of extravasation have been reported, okay, for the inpatients. So that's why we are doing this refreshment session to just refresh your mind regarding using this IV cannula. Okay. As I'm going to give you a small demonstration about it. First of all, I would just like to know how many of you know about the needle notch technology or the first needle success. Are you taking the advantage from this benefit?
Yes.
Okay. What is that? Can you explain to me? That what is the first needle success or the needle notch technology?
Because we use the reverse technique. Instead of the IV cannulation technique, we are using the reverse. Instead of putting it inside, we are taking it back.
Yeah, but here there is a a big feature of this cannula.
Because it was
Is the needle notch technology. Okay, we called it as the first needle success. That as soon as you are going to insert this cannula, you will see the first flashback here, right? So as soon as you will go continuously for the advancement, the blood will continuously flow through this extension tube and will collect it in this vent plug. Okay, this vent plug is completely secured, so no chances of any blood exposure. Okay. I would just like to know that, are you using any high angle or any angle for the insertion? Are you following up? What is the best angle for the insertion?
Angle.
You are using a parallel? Okay.
How many
I
degrees?
need more answers, please. She's saying she's doing parallel.
How many degrees? Degree angle.
Is there any specific degree that you are following up, or you are going parallel with the skin?
So ano yung subcutaneous? Intradermal ba yun?
Okay. What about you guys? Are you going parallel with the skin, like you're going for the insertion like this?
30 to 45 degrees.
Let me clear, because if you are going to do this cannulation by parallel with the skin, you will not be able to see the flashback.
Yes. Mm-hmm.
Okay, because this parallel insertion will not give you the benefit. So to get the benefit of the needle notch technology or the first needle success, you have to go for the 30 to 45 degree of angle for the insertion. As soon as you will see the flashback, then you can lower the angle and complete the advancement. Okay, what I will tell you that still why the extravasation cases have been reported, according to our observation, what the nurses are doing or the practice is following up to see the flashback of the blood, the nurses are still doing the back and forth motion, in order to make sure that maybe they are in the vein or they are not in the vein, which actually results the double puncturing of the vein. Okay. As a result of which, when you do the back and forth motion with the needle in order to take the flashback of the blood, you actually hitting the posterior wall of the vein, which is actually causing the double puncturing. As a result of which, even still you will be using the BD Nexiva diffusives, still you will face the extravasation. So in order to avoid this problem, you have to go for the 30 to 45 degree, okay, for the insertion, because by this angle you will be protecting the posterior wall of the vein also from heating. Okay. As soon as you will see the flashback here, then you can lower the angle and go for the advancement. Okay, this is, and other thing that I would like to talk about, are you taking any recommendation for the best site of insertion for this cannula, or you are taking any site of insertion for the insertion?
Mostly we are using
Sorry?
Mostly we are using anti-cubital.
Anti-cubital, great. Any more? Okay, so best recommendation site of insertion for this cannula is always anti-cubital. Okay, is our recommendation. I know for the pediatrics, then there is another challenging having come up. Okay, then there could be other ways, but the recommendation is to use the anti-cubital. Why? Because if you are using the metacarpal, first of all, there is a joint manipulation. Second thing, that the tissue mass is very less here. Okay, God forbid if the extravasation going to happen, the damage will be directly to the bone. And you know, the damage to the bone is completely irreversible. Okay, but damage, for example, if you are using the anti-cubital, the tissue mass is more. Okay, if God forbids the extravasation going to happen, the damage will directly happen to the tissue, not to the bone. So that's why we are saying to best recommendation for the site of insertion is anti-cubital. Okay, now I will just do a small demonstration in front of you in order to how to take the benefit of the needle notch technology and what are the other features. Okay, just after removing the packaging, remove the needle cover, and now I am going to breaking the seal. Okay, this step is also very important. Okay, please have a look that how I am going to break the seal. I will pull the white part and push it back. Are you following up this step? Pull up this white part and push it back, and make sure that the needle and cannula are snugly together. Okay, like this. Okay, then I will make sure that this vent plug is secured because it is giving you the protection from blood exposure, and this vent plug should be open. Okay, this clamp should always be open, because if you're going to close, there will be no backflow of the blood. Okay, so always should be open. Then I'm going for the higher angle. Can you do tourniquet for me, please? Just only press little. Thank you. You can come close by. Okay, please come close by. Okay, just I did all the procedures. Now I'm going to hit the vein. See, I'm going to take the higher angle now. Now I'm not going for the normal angle. Okay, I see the flashback now. Now I will lower the angle, and okay, I will do little bit advancement. How then I'm going to insert? I will hold this white part and push the gray one with the other hand or with the same hand. Okay, like this. Okay, then after that I have to hold this wing platform and remove the needle. Okay, needle is completely locked, so no chance of any needle stick injury. Then after that, the next step, you should secure your device, whatever the dressing you are using. Okay, make sure that this septum should always be covered. Okay, one question, one answer I would like to give here. Okay, as you see, the blood flow is stopped here. Okay, what is the reason? Maybe it's some reason that the pressure inside, because it's a training arm, not the human. Yeah. But sometimes even with the patients, you also see this problem that the blood is stopped flowing. What is the mean? This is the mean that your cannula is already outside the vein. Yeah. Okay, that's why there is no backflow of the blood is going through this extension tube. So if you are going to send this patient to the radiology, 100% there will be extravasation. Okay, so in order to avoid this problem, and if you face this problem, what the solution that you will immediately remove the cannula and will go for the other insertion. Okay. Okay, now I have put the dressing. I will cover this, secure the device. Then I'm going to close the clamp. Okay, remove the vent plug, and with the flush syringe. Okay, I will attach the flush syringe. Okay, open the clamp, and we'll do the push pause technique. Okay, right now the flush is little bit less here. I don't want to open the. Okay, fine. Let me open. Yeah, here you did another mistake. I was actually waiting for this.
There.
Where? See here. By using the flush syringe, please follow this technique also, that because she just opened the stopper. Okay. Here is the thing that you have to make sure about the sterility of the flush syringe. Okay. How you are going to make sure that after opening the packaging, you have to push the plunger. I push the plunger. I hear a click, small sound. This is the breaking of the seal. Then I will open the stopper, and now I remove the excess air. Okay, who can tell me what is the best technique for the flushing? Push and pause. Great. Push and pause will generate a turbulent flow. Okay, as a result of which all the areas of your IV line will be completely clean. Because with the single push, only the flush will run in a streamline, and still there is the upper parts may be untouched from the flushing. So always go for the proper volume and with the proper flushing technique. Okay. Then after that, the flushing, I will remove the flush syringe, and no, I think I have. Then either you can close this one with the needleless connector that is already available, okay, or with the injection plug given in that. Now your patient is ready to send for the CT scan. Okay. Now there are some questions have been come up that some nurses have been asked that can we use this cannula for the normal infusion? No, you cannot use this cannula for the normal infusion because of your hospital policy is also not recommended. Okay, then there was another question that after the CT scan procedure, if the patient can come back to us, can we use this cannula for the normal infusion? No, a big no. Why? Because after the CT scan procedures, okay, the vein and the same area got highly irritated. Okay, even if you are going to use the same cannula or other cannula at the same site of insertion, you will face the many complications. Okay, so definitely never use the same site of insertion and same cannula after the CT scan procedures. Okay, this is from my side. Please, if you have any question, go ahead.
Remove the Nexiva after use.
When we are giving also the contrast.
Sorry?
We can keep the needleless connector while we are giving the contrast.
No, you have to remove. Yeah, you can use. If your power injector tubing can attach with the needleless connector, you can use this one. Okay.
Because last time when we attended this one, they said better not to use the needleless connector.
Yeah, that's what I'm
you
going to
not
say.
give the exact flow what you desire.
Yeah, that's what I was about to say, that you can use this one, but actually our recommendation, in order to get the required pressure, you should remove any device in between. Either it's a needleless connector or whatever, even any connecting tubing you have attached. So always make sure to connect your tubing of the power injector directly here. Okay. Any more questions, please?
Yes, after insertion, can we collect blood from that cannula before sending the patient to the...
Yeah, you can collect the blood, okay, but make sure with the proper flushing before and after the blood withdrawn. Okay. Any more questions, please? So I would just repeat that what is the best site of angle? 30 to 45 degrees. And what is the benefit for this one? To see the flashback of the blood. Okay, first needle success, we called it. Okay, and usually the best site of insertion is also the anti-cubic. Okay, these were all things for me. Any questions again, please?
Questions?
So far, okay?
Wala ng question.
Also, you know, the
So you have to remove the
someone
cannula
following the
after
proper technique
use,
what we are
okay?
doing with the Nexiva.
So this is not for infusion, other infusion. After use, you have to remove the next. After the CT scan, remove the cannula. Okay, that's it.
Instead of releasing back
In
the
emergency, for example,
stylet,
the patient has allergic reaction and there is
some are inserting directly
Yeah.
without it cause also advancement of needle through the back wall of the
Yeah,
patient.
exactly. Sometimes,
Mostly,
you
I
know,
think this is the reason we are facing with this extra.
yeah. Okay, never do the back and forth motion with the needle,
Like
because
what we are
if you
doing
will,
with the IV cannula.
yeah, because this is the different kind of IV cannula. That's why we are saying that it is having the needle notch technology. You can easily observe the flashback of the blood along with the needle. Okay, so there is no need to do the back and forth in order to see the backflow, because this is the main advantage of this cannula. And also one more thing, that sometime during the back and forth motion, what happened that actually you remove the needle, but you are trying to insert the cannula. Okay, what will happen, because the cannula is again plastic, you know, it's a plastic material. The plastic
Can kink
material will
inside.
kink or the blanch. Okay, so this will create another complication. So never do the back and forth motion with this cannula. Please keep in your mind. All clear?
Okay.
Thank you very much.
Thank you.
Thank you so much.
Thank you.
Thank you.